My name's Brian Ramacco, and today I'd like to talk about osteoarthritis. Osteoarthritis is a little different from rheumatoid arthritis or lupus. There are inflammatory arthropathies, which are autoimmune conditions. Basically, your body is attacking itself. And that's not what I'm going to talk about today. I'm talking about osteoarthritis. This is the wear and tear type arthritis. Now, I think osteoarthritis is often a scapegoat. It is an easy radiographic or MRI finding to pick on to pin everyone's problem onto. But most people's pain is not from osteoarthritis. I'll say it again. Your pain is likely not related to your osteoarthritis. Your osteoarthritis might be related to what's causing your pain. And there are cases where osteoarthritis can be directly linked to pain and decreases in function. But the vast majority of cases, osteoarthritis is not causing your pain directly. Now, first, I have a whole video on this, but first let's talk about pain. Pain does not equal damage. Pain is a protection system. It's a signaling system to tell you to protect something while it heals or to get away from something. So it's a signaling system. You can have pain without damage, and even if there is damage, your pain isn't necessarily proportional to the damage. It's proportional to your brain's interpretation of the danger. Oh my goodness. Chiropractors and medical doctors have actually been accused of increasing people's pain by showing people x-rays and saying, look, there's your problem. Oh yeah, the bones are just grinding together. Your brain looks at it and says, oh, grinding. Oh, that sounds bad. Oh, every step I'm taking is damaging. Every step I'm taking is bad for me. Your brain is sort of smart in its protective mechanism. The part of your brain that creates pain has access to those thoughts and those memories. And it's like, oh, so I'm not supposed to use my knee. So it will make moving your knee painful. Your brain can recruit motion receptors to report as pain if it thinks it's to protect you. So if you're told moving your knee is going to cause damage, moving your knee is dangerous, moving your knee is bad, then your brain's like, okay, moving my knee is bad. Oh, I better let the conscious brain know whenever I move the knee. I'll make moving the knee painful. Now, of course, it's not just in your head. Well, frankly, everything's in your head. It's always in your head because our interpretation of the world is always through our brain. But it isn't just pain with no source. It isn't just pain as protection, just pain connected to movement. You can have pain connected to movement and multiple types of pain stacked on top of that. You can have, typically people develop a sort of a limp, and from incorrectly using your muscles, you get these painful muscle knots. You can get something called a tendinosis, which is a weakened and sickly tendon from improperly using your muscles and tendons or not using the muscles and tendons enough. And sickly tendons tend to be painful whenever you pull on the tendon. And sickly tendons are prone to micro tears and tears. So I'm not saying that there's no damage or there's nothing wrong with you. Is you can have something wrong with you or your brain can ramp up the pain. Whatever's wrong with you, it might be increasing the pain even more because you're thinking, oh, moving equals damage because the doctor said it's arthritis, and it's grinding. In my knee, it's grinding with every step. So your pain is unlikely to be related to that grind. Now, why do I say that with such confidence? Research, research. It's not just me, also clinical experience. I remember, so I'm a sonographer, and a specialist sonographer for MSK, musculoskeletal sonography, and nerves as well. And what doesn't show up on x-rays is cartilage. So for knee osteoarthritis, they typically diagnose it based on a decrease in joint space. So the joints, the bones are closer together, therefore there's probably no cartilage left and it's probably grinding. But with the ultrasound, I can actually look at the cartilage. So I remember this one patient with knee pain, and I looked at her knee and there was no cartilage left, and none. and it was all bumpy bone. I'm like, okay, so if anyone's going to have, like, I've seen knee arthritis before. This is like one of the worst cases of knee arthritis I've ever seen, and no cartilage left. If anyone's going to have pain from the arthritis, it's got to be this person. Well, I kept on looking because her pain was a little bit more on the side, and I saw some sort of really disorganized tissue. And I was like, that looks like scar tissue. I pressed on it. Is that your pain? Oh, that's exactly my pain. Okay. Well, if you don't know, you can break up scar tissue. So I grinding into that scar tissue and breaking it up. It was a little tender afterwards, a little bit swollen from all of me breaking it up, but wasn't that sharp tenderness and that sharp pulling, which he was describing as like a sharp pain when she tried to do yoga. So I said, okay, do your yoga move. She's like, the pain's gone. The pain's gone. Like I couldn't believe it. Like, you don't have your pain from the arthritis. So she had no pain, zero pain, zero pain. Worst arthritis I've ever seen. And it's not just my clinical experience. I love to sort. There's two papers I like to cite. One was a research study for hip arthritis, where they took a whole bunch of people, elderly people, hip pain, no hip pain, and they x-rayed everyone to diagnose people whether they had hip arthritis or not. And they expected all the hip arthritis was going to be in the pain group. And that's not what they found. They found that, I believe it was 9% of people had hip arthritis in the pain-free group, and 12% of people had hip arthritis in the painful group. And so that's close. So you're right. More people with pain had hip arthritis. And I mentioned, in my mind, it still might not be from the arthritis because improper biomechanics can increase the progression of osteoarthritis. So there is that link as well. So maybe, a third or a quarter of the time, maybe arthritis is associated with pain. But 9% of the time it's a normal finding. So if you take that out of the 12 or 13%, that only leaves you like 3 or 4% of that group. It's associated with the arthritis. And again, the arthritis might be a symptom rather than a cause. So, and the conclusion of the study, so it's not just me, the people who are writing the study is like, you cannot tell people from now on, you can't x-ray someone, say arthritis, and you can't say, oh, arthritis, that's the cause of your pain. You can't do that anymore. And you shouldn't be doing that anymore because it's such a normal finding that you cannot say that. You just can't say that. But how many people watching this have had a doctor or chiropractors love to do this? Oh, you have to come see me every week the rest of your life. Look, you have degenerated discs. Everything needs to be aligned every week. Scammers. Okay, back to the topic. So, yes, arthritis, unlikely to cause your pain. Mind you, if the wear and tear is such that you can't move the joint properly anymore, it's time for a hip replacement. If there's a lot of fluid collecting, then you can, of course, do aspirations and injections for that. And again, might be sign for a joint replacement. So I'm not saying osteoarthritis is totally benign. I'm saying it's unlikely to cause you pain. And if you have pain, explore the options. They find that people with arthritis, whether it's shoulder arthritis, hand arthritis, knee arthritis, that almost all cases of arthritis, unless it's gone to the point again where they can't move their joints, almost all cases of arthritis improve with exercises. Now, if this is truly wear and tear, osteoarthritis never gets better. It only gets worse. You only get more osteoarthritis. You only get more wear and tear. So why would exercise, which is used in the joint, which in theory only makes the joint worse, why would that improve pain scores, improve function scores? Why would that work? Well, it could be because, as I mentioned, your pain is likely going to muscle-related, tendon-related, ligament-related, scar tissue-related. It's other things. And also, particularly for the knee, if you have a muscle imbalance, basically you're running your knee on just one side, and patella's running crooked and grinding just on one side. And if you can do the exercises and get your muscles, your quads, all equalized on both sides, and I'm talking about like within a quad, we have quad muscles, 4 muscles, we have vastus lateralis on one side, we have vastus medialis on the other. If you can get these muscles balanced, a lot of people with osteoarthritis have atrophy in fact, muscle wasting of the inside quad muscle. If you can get those muscles bulked up again, if your knee can function properly again, if your hip can function properly again, then that will eliminate a lot of people's hip pain and knee pain. Oh my goodness. I sometimes demonstrate for people what incorrect biomechanics looks like. And when I demonstrate it, my knee and my hip hurt. If I end up demonstrating for 2 or 3 people, I'm almost limping at the end of the day because I'm just showing people how they're moving, and it's painful and it causes pain just moving that way. So if you can relearn proper biomechanics, that can over the long period of time actually reduce the progression of osteoarthritis, and that can greatly reduce pain. Of course, I also suggest basically chasing down muscle knot pain and things like that. Um, the other thing about osteoarthritis is it has such a bad connotation. I think we should rename it to um, age-related bony changes. Oh, they found on my x-rays some age-related bony changes. Because everyone gets it. Everyone gets these changes. And that doesn't sound scary. It's just like, oh, those are normal findings for my age group. Now I'm going to talk about a bit of a personal story with me, with my neck. In my 20s, late 20s, I was diagnosed with neck osteoarthritis. So I had the neck of not a 20-year-old, of a 40 or 50-year-old in terms of its age-related progression. And of course, the doctor's like, oh, yeah, that's your problem. But I had pain back then. I don't have any neck pain now. So the osteoarthritis didn't go away. And why did I have osteoarthritis at such a young age? So I had basically neck, something called a functional instability in my neck, which is caused or is caused by weak muscles or weak neuromuscular control of the neck. These really tight muscles, or these long muscles, become tight to sort of protect the neck. So I had really tight, achy muscles all the time because the tiny muscles had basically forgotten how to control my neck. Of course, the solution was to retrain the neck, and then the large muscles then relaxed. But all those years, both sides of my neck were so tight and stiff. You can imagine the bones were held together tighter, which that progressed the age-related changes a bit faster than they should have. Yeah, now I'm pain-free, and the osteoarthritis hasn't gone anywhere. It's just normal age-related bony changes. Now, it's not just the age-related bony changes. I mentioned there's 2 papers that I like to show people. One of them is that hip one, and the other one is a table that I take, and I have it printed out, and I put it right in front of them. Because how many people with neck pain, back pain, they come in and said, oh yeah, like I'm always going to have back pain. They said I have disc degeneration. Or like I had a disc herniation, 20 years ago, so I'm always going to have back pain now. Or whatever their spinal finding. And this research paper, this table, is just a list of radiographic and imaging findings in an asymptomatic population, and it's done by age group. And asymptomatic, which means they have no problems. And so if you look for arthritis, it's you don't really find it that often in the young individuals, but you find 80-90% of people with no pain are diagnosed with arthritis in their spine as people age. It's just more common because it's just age-related changes. And for those degenerated discs, yeah, most people above the age of 40 have degenerated discs, and that's normal. It's normal. It means nothing to me. So now I can't guarantee that, again, osteoarthritis can't cause pain. And again, when it gets bad enough, there are times for a joint replacement. But I'll tell the vast majority of people, osteoarthritis is not causing pain. It's just age-related bony changes. It is normal. It's likely your source of pain is something else. And I invite you to, and I encourage you to search out the sources of your pain so you can get rid of them. I wrote a whole book to try to educate patients to sort of self-manage, to try to navigate the healthcare system, to try to get to the bottom of their problems so they can get out of chronic pain. Just as sort of a hint, that the solution to most people's problems is get rid of painful stuff and exercise, so painful stuff doesn't come back. That's typically Reader's Digest version. Anyway, if you want, you can of course purchase my book. I wish everyone the best of luck. I don't want you to think every movement you're making is grinding and bad. Like my neck, it does sound like sand when I turn my neck, but I know that's just normal. It's not painful. But if you think about it, grinding causes pain, your brain is going to make it true. So be confident in your body. Hopefully, you're leaving here with an optimistic attitude that, oh, like I can still be pain free even if I have osteoarthritis. I wish you the best. Good luck. Cheers.